Hey guys, it's TZ and I'm back with my part 2 update. Okay, so this is part 2 of my update. Promise there is a rainbow at the end of this what do you want to call it? This storm that's going on. There's a rainbow, so trust me, just stick with me. Okay, so where I left off in my last video, I stated that we did our last round of IVF. We did our last transfer right at the beginning of COVID, so last March. Actually, when I was uploading the video, when I was uploading the video, I seen the last video that I had did, which was March 30th, and that was when CNY called me to tell me that my transfer failed. So it was actually March 30th, so it's been over a year since all of this has happened. So yeah, okay, so let's see, okay, so as far as some things that have been going on in my life, my husband and I, we decided to start counseling. I'm not gonna say that it was a result of the IVF failure, but we were at a point to where we figured that we needed counseling. So it's been almost a year since we've started counseling. I think I want to say it was like in April or May that we started, and we've been doing couples counseling, and I've also been doing like some counselor individual counseling as well with another counselor on occasion as needed. I've talked about it in the past, and I think that is healthy. So if you are need to seek help or talk to someone, I always recommend to invest in your mental health and talk to a counselor. There's nothing wrong with it. Sometimes you don't want to bother your friends and family and burden them with all the things that's going on in your life. And talking to a counselor, like, that's their job, you know what I mean? And they're able to just help you and talk you through some things that you're going through and how you're feeling. So so I do that as needed. And then I do have some books that I have, some like self-help books. Those have been really helpful during some times where I didn't feel like counseling was needed or just talking to somebody, but it's stuff that I wanted to like learn how to do on my own. So if you are interested in those books, let me know. But one is like a 7-week book, and the other one is like, I guess, an ongoing book. But I just did some research and I found those, and it's really worked well for me. So that's where I am as far as with that part of my life. So a year ago, around this time a year ago, like I said, I was at a point to where I was like, I'm not going through this anymore, this whole IVF cycle. I figured that I was done. And then I also turned 42 in July. So I'm currently 42 years old, and I'm like, what am I gonna do, type of thing. It was like, I think after that I was like, damn, I'm 42, should I try one more time or should I just let it go? And again, as far as like where we were in our relationship, I just wasn't sure like what, it's just unknown. It was like a lot of unknowns. So I didn't know if I should freeze my eggs, like what should I do? I don't know. I was at a point to like, should I freeze my eggs, or should I just see like, you know, how much time do I have left, you know, have them check my AMH level, stuff like that. And so yeah, so I decided to go back to CNY, I want to say maybe September, October-ish, just so September, October-ish, just so I can see where everything was, you know what I mean? So again, since we had transferred our last embryo, and if I wanted to do another egg retrieval, I'm starting from scratch. I'm starting it all over again, right? Sucks. So they before you do your baselines and all that stuff, you have to do the hysterosalpingogram. Did I say that right? Hold on, to look it up. Hysterosalpingogram. I always mess this up, guys. Hysterosalpingogram. How about this? How about a HSG test? So pretty much what that is that's when they insert the saline into your uterus, and then they see if you have any polyps, any fibroids, if your fallopian tubes are open. They do that. I knew before I had some fibroids that came back during the transfers. When I would go in for my baselines, they said it wasn't nothing really to worry about. They weren't inside my uterine like cavity. They were in my uterine, I guess, my wall or lining, so it wasn't a problem. They said it wouldn't like impact my transfers or anything like that. So when I had the HSG test done, I didn't have any polyps this time. I did have some before, they removed them. This time, no polyps, but the doctor did say that I had some fibroids that grew back. And my fibroids before, I had them inside my uterus. I had them in in my uterine wall or lining. Then I had some that was growing from the uterine lining into like my uterus, and those were like the worst ones. So the doctor noticed that same thing in this case. I had some that were growing both, like all three scenarios type of thing. So he did recommend that I have another myomectomy. The doctor that I seen that did my HSG test was Dr. Chang. I had heard of him before, but that was the first time that I had had an appointment with him, and he was really nice. He asked me if he said that he knew a really good doctor in Buffalo that would do the procedure if I didn't want to go through CNY. It was my choice, but I told him I would probably just stick with CNY. I know Dr. Kiltz does the surgery often. My concern was I didn't want to do another like myomectomy where they cut me open, and if they could do it laparoscopically, but he was like, he wasn't sure at that time, because he was saying like just depending on where they were, like he said that they would try, but he said that he knew that the doctor in Buffalo would probably definitely be able to do it. But I opted not to go with that doctor. I decided to stay within CNY and have Dr. Kiltz do it. So so like I said, that was maybe September, October-ish that I had that HSG test. So they scheduled it out. They scheduled my my procedure out. So when I got the call for them to confirm or schedule my appointment, it was for January, which was, when you think about it, wasn't really a long time. I was like, okay, I could wait till January. It's not a problem. So the COVID numbers start rising again, and I was like, these numbers are kind of high. Like, should I be getting this procedure now? Like, or should I just wait? And like 2 weeks before my procedure, they called to cancel my appointment because of the COVID cases. I had to travel to Syracuse to get the procedure done. So they were not doing any outpatient procedures. So they canceled it and said that once, you know, the numbers went back down, and once the numbers went back down, they said that, you know, they would call me. I'll be like at the very top of the list, since I was like only 2 weeks away from my scheduled appointment. So they would call me back to schedule it. Got a call late January. They scheduled it for February 26th, I think. So February 26th is when they scheduled my appointment, and I went to Syracuse to get the procedure done with Dr. Kiltz. Got there like at about maybe 6 o'clock in the morning. Again, just because due to COVID, like you're not able to have anyone come in to like as support. So my husband had to wait in a car the whole time, and like he just dropped me off, and then I went upstairs pretty much by myself and did everything by myself. Let's see, so this one was a little bit different than the first time I had my myomectomy. This time they were to do it laparoscopically, where they do the incisions and not open you up. Like sometimes you have like a horizontal or vertical like scar, just depending, but I have like that horizontal scar like on my bikini line for my first one. So my appointment, I think, was scheduled for like 9 o'clock, but we had to get there early to do like pre-op work and all that stuff. Here comes Dr. Kiltz, comes in the room. I was like in a like a pre-op room, I guess, or whatever. Bouncing off the walls like usual. If you don't know Dr. Kiltz is full of energy. He's always just, he's full of like keto energy. I don't know, I can't explain it. He's always bouncing off the walls, but he always makes you feel like comfortable, you know what I mean? So I felt comfortable. The first time I was nervous because I had never had surgery before, but now after having egg retrievals and all this stuff, like I'm kind of comfortable more now than I was when I had my myomectomy back in 2013. So yeah, so I go to get the procedure done. I wake up and, you know, the nurse is waking me up and she's like, wake up, sweetheart, you know, it's over. She's like, Dr. Kiltz wasn't able to do your, she tells me that Dr. Kiltz was not able to do my, my procedure. And when you're coming out of anesthesia, like it's like a lot, like you're kind of still sleepy and you're trying to like pay attention. And so she tells me that Dr. Kiltz was going to be in a moment. So I'm kind of in and out of like sleep at that point. And then again, here comes Dr. Kiltz bouncing off the walls, ball of energy. And he's trying to explain to me like why he wasn't able to do the procedure, but I was still like coming out of the anesthesia, so I didn't understand it like exactly like why. But he told me that he was able to remove a lot of the scar tissue that I had. He told me that, at that time what I thought, he told me that my colon, which is your large intestines, was, what did he say? So basically, my colon is attached to like my abdominal wall. So he wasn't able to remove the fibroids because my colon or my large intestines is fused to different like organs, or it is fused to my abdomen. He just said my abdomen or whatever. So he was saying that he couldn't do the procedure because at that time it would have been an 8-hour procedure, which was something that was supposed to be like a 2-hour procedure. And he said if he would have proceeded to do it, when I woke up I would have had a colostomy bag. Again, just not processing it all at one time because I was still like coming out of the anesthesia. And I suffer from health anxiety. Like I am so like anxious when it comes to like my health, where yeah, I just suffer from like health anxiety. Like I just get really, really worried. So when he said colostomy bag, I immediately thought of my mom, because my mom had colon cancer. So it was like, oh my gosh, like I'm thinking like, do I have colon cancer? Like, is that like, did they find something? Like this is what like my head is kind of like processing and stuff like that. So he was like, don't worry, we're gonna get the procedure done, but you know, he has to schedule it with another surgeon. So that's kind of how we left off. When I went downstairs, I asked my husband, like, did Dr. Kiltz, because Dr. Kiltz called him, and he kind of told him the same thing, but my husband didn't understand either. So fast forward, they called me for my 2-week checkup. Everything's good. And then I think like 2 days later I get a call from a nurse, and she's like, did you schedule your CT scan yet? And I'm like, CT scan? Like, what are you talking about? CT scan for what? And she's like, it's for your surgery. And I'm like, why do I need a CT scan? Like, I don't understand what's going on. So she kind of didn't know either. So she's like, I'm gonna give you Dr. Kiltz's number and you can call Dr. Kiltz and just talk to him. So she gave me his number and I called him. I thought I was gonna leave him a message, but he actually picked up, and I was like, oh, like, hi Dr. Kiltz, like this is, you know, TZ, do you remember me? And he's like, oh yeah, because it was 2 weeks later. But so he kind of explained it to me more in detail now that I was alert and, you know, awake. But basically kind of like how I said it, that's not how I remember it, but when he told me when I was coming out of anesthesia. But basically my I guess from my previous myomectomy, because like I said, they opened me up after the procedure sometimes, and this is when I went to my other appointment this week, my OBGYN kind of said the same thing. She said when you have an invasive surgery, when you have an invasive procedure, sometimes your organs just move around, get fused, and she said yes, it can happen. So my colon, again, which is your large intestines, is attached to my abdominal wall or area. Again, not sure if it's attached to my uterus or like where exactly, so that's why I have to get the CT scan so they can see exactly where like where it's attached. And so the CT scan will help them determine like when they're going for surgery, like where they're cutting and like, you know, what has to be done. So I am gonna get the procedure done. Actually, on Monday, I have my appointment to get my CT scan done, and then then there's gonna be Dr. Kiltz is gonna do my myomectomy, and then another surgeon is gonna be there to detach my colon from my abdominal area, which is possibly my uterus. Why me? Right? I don't understand sometimes. So that's where that is. And I had my OBGYN appointment this week, and just talking to my doctor, she said that it's great that I'm going to get all that done now, even if I don't kind of, you know, have it, even if whatever path I go, she was saying that it's good to get that done now, because I don't know what type of health issues I'll have in the future with that, you know, with my colon being attached to my abdominal wall and stuff like that, or even like, you know, if I were to get pregnant, like what would happen. So and then she also kind of reassured me like that. She was like, you know, you're still young. She said that she has 2 patients right now that are both age 48 that are currently pregnant. They are pregnant with donor eggs, but she said that they're pregnant. So she was like, you have time. Like, she's always like telling me that she thinks about me, and she's always praying for me, and every time she sees me, she's like, I'm wishing you the best, and I'm hoping that when you come back, like, you're pregnant and stuff like that. So positive there. But I have like a few more minutes before I wrap this up. Some other health things that are going on. So I'm not sure if I ever talked about it on my channel before, but I do have a heart condition, and I was diagnosed in 2018. It was ongoing, and then finally, it's always like a doctor saying, you have something, oh no, you're fine, this is not. But back in 2018, I was finally like diagnosed with a heart condition. Cardiologist said, don't worry about it, like, you're fine, you don't need to be on medication. I'll see you like in 5 to 10 years. We'll reevaluate you then, see how things are going, and then we'll go from there. Fast forward, so I knew that, and they said I didn't have to go on any type of medication at that time. I was fine. I get my annual like physical every January, and so I had my physical done this past January. And there's another reason why I always get my physical, but there's another reason why, again, this is kind of following to like the rainbow at the end. But during my physical, they hook you up to an EKG, and when they hooked me up to the EKG, my heart was doing what it does, and it finally did it at that point, because usually, like I said, it wasn't a problem as far as like where I was on the scale. It was either 2% or 0.2, so it was something that they kind of didn't always catch, but at that point the doctor caught it. So he's like, I want you to go on another Holter monitor for like another a Holter monitor. So a Holter monitor is when you wear like a device for about 48 hours, and they monitor your heartbeats and stuff like that. So did the Holter monitor. After I did that, I get a call from my doctor telling me that, well, I'm sorry, not even the doctor, the nurse telling me that she called in a prescription. I was like, a prescription for what? Like, what are you talking about? She's like, for your heart medicine. It was like, excuse me, what are you talking about? So she was like, oh yeah, the doctor prescribed such and such medication. I was like, why? Like, my doctor didn't call me to tell me the results. I thought I was fine. Like, I've had a Holter monitor before. Usually they'll discuss the results and say, it's fine, but she called me before the doctor to tell me that that they were putting me on heart medication. Again, my health anxiety kicks in. Before I even got home, I'm like literally like crying, bawling my eyes out. And my doctor knows me enough to know that she shouldn't have had the damn nurse call before she called. So by the time I got home, she calls me, and she calls me and she's like, calm down, because I'm like hysterical crying. She's like, calm down, it's okay, you don't have to take it. She told me why she prescribed it. I think at that point they had already my follow-ups with the cardiologist, so she's like, don't take it, you have your appointment with the cardiologist. I have a new cardiologist now, my other one retired, so she was like, just wait, don't take it until you see the cardiologist. So got to see the cardiologist. So I go to see the cardiologist, and at that point as well, you know, he's examining me and stuff like that. And he's like, I don't think you need to be on the medication right now. Just hold off on taking it. I want you to do a stress test, like an echo stress test. And then we'll kind of just go from there. So get my stress test done. And then after that, I had my stress test done Tuesday, the Tuesday before I had my fibroid surgery in February. So I wanted to get it done because I know you have to like walk or run, and then so I figured I would do the stress test before I have that procedure, because I didn't know how I was gonna feel afterwards. So I had the stress test done, and then the cardiologist called me and said, yeah, I need you to go on the medication. So I told him I was like, is it okay if I still get my surgery done? He said, yeah, just wait till after you have your surgery to start the medication. So he told me to start it like that Friday. So which is what I did. So I had the surgery that, even though he didn't do a lot, he did remove scar tissue, and I just still have some soreness, and I was bloated and some bleeding, and I do have those 5 like points from where he did the procedure. So he did do something, like he did do the scar removal, but so I still was sore. I thought I was gonna be better than I was, but he told me that I was still supposed to relax, but I kind of wasn't. So I was kind of out shopping, and when I probably should have been home, and I thought that I was just gonna pass out like right then and there, and I didn't know. I had just started the medication. I didn't know if it was a medication or just, again, I shouldn't have been out shopping. I should have just been home resting like the doctor told me to. But my heart was just like racing, like pounding. So I was like, you know what? I think it's the medication. So it's like, I'm not gonna take it. I'm gonna stop taking the medication. So I took myself off the medication, and I called my cardiologist that Monday and told him like, yo, I think it's the medication that was making me sick, that was making my heart race. So I talked to the nurse, and she said, she asked me if I had a blood pressure cuff, which I do. So I was like, yeah, I have it. So she told me to take my blood pressure, and it was like 70/40 or something. It was something really, really low. And so that the blood pressure medicine, or it's not even blood pressure, it's a heart medication, but it also, I guess, it slows down your heart rate, your heartbeat. So okay, I'm really gonna wrap this up because I don't have any more storage. So it dropped my blood pressure like really, really low. So that's why I was feeling that way, and the dizziness and stuff. So the doctor's like, I don't want you off it. And I'm like, I need to get off this. So he's like, so they told me to take a half a dose instead of, a half pill instead of a full pill. He's like, it was like, with what's going on with my heart right now, he's like, I don't feel comfortable taking you off of the medication. So, so that was in February. So, and then he's like, I'm going to schedule an MRI on your heart because they want to rule out a heart condition, like a rare heart condition. He said he didn't think that I had it, but he said he just wanted to rule it out, and then from there they'll determine if I need heart surgery or if they need to put me on a different medication. So for the last couple of weeks, it's been like an ongoing battle with this heart medication and like how I feel. I think right now I'm at a good balance, but like before I was fine, walking around normal, but like I can barely go out of the house without me feeling dizzy or my heart beating or something weird that's going on, some type of side effect from this medication. So it's kind of really slowed me down, and it's really slowed me down and stuff. So I had an MRI on my heart last week, and was waiting to consult with my doctor on the next steps with that. So to see if I'm going to be on a different medication, because I can't stand this medication, because it's like I said, it's just right now this past week I've been I've been pretty okay, but I haven't been really like trying to leave out the house and stuff like that. So also with that and fertility, that puts me even at a higher risk. So one other option that my husband and I had talked about before was a surrogacy. So if I possibly do an egg retrieval, then, you know, moving forward, I may not carry, but possibly have like a surrogate. And we did have 2 people volunteer to be a surrogate for us. So that may be an option moving forward. So I'm gonna stop it here because I'm running out of space, and like I said, I don't want to keep it long so that way I don't have to edit the videos as much. But I promise you guys, there is a rainbow at the end of this this update. So there is gonna be a part 3. So I'm not gonna wait that long to update it. I need to clean out some of these old videos and stuff off of my memory cards and all that stuff, and then I'm going to do another video and I'll upload that. So thank you guys for tuning in. I miss you guys so much. Thank you guys for being just so supportive and listening to me rant, my mini rants and stuff like that, and just listening to my story. So I will talk to you guys in my next video. Okay, bye guys.